So today, we'll dig into 5 critical categories: depth, rate, force, rhythm, and form. And I'm going to show you what is essentially a contemporary model of diagnosis, contemporary in the sense that it's pretty well established by about the 16th century or so. So in that sense, it's a little modern. Very much what's being used in the mainstream today. And folks were kind enough to set this up. You know the one slide they didn't do, Marnie? It was the page with the reference for the pulse positions. I'll see if I can deal with it after lunch. It's okay. It's not a big deal. So then we'll go to a practicum just on fingering, finger position, 5 critical categories, and then we'll spend some time on pulse image and mechanism. I'm about to give up on this. There we go. And the second half of the day will be much more practicum intense, and probably because of our size, we'll be able to spend some time on special pulses, pulses in gynecology, and other topics as well. So that we kind of planned for that eventuality. All of you know this, but it's really important to understand. Sometimes there's an idea, and it's funny because it's an idea both in the West and in China, and if you look at the classics from the Huangdi Neijing on, every scholar of pulse will tell you that you can't do pulse independently of taking a history, doing palpatory assessment, doing examination. In other words, pulse really used independently is a very risky diagnostic intervention in classical Chinese medicine. So whenever I teach pulse, I like to be sure that what's understood is that really the most important aspect of diagnosis in Chinese medicine is inquiry, or the history. And that may seem a little odd because I think sometimes we have this image of the sage, you know, reaching out and taking the pulse of the patient and everything is revealed, right? And I've worked with a few of these sages. In fact, maybe since I've now launched into this whole conversation, I should stop for a minute and talk a little bit about our background and what we do. The core of this lecture comes from a textbook that Marnie translated, and I'm the editor of. It's Tie Tao Deng's Practical Diagnosis in TCM, which is from Elsevier and is really an outstanding, very traditional text on Chinese medicine. I got very interested in pulse diagnosis when I started studying Tibetan medicine in 1979, or actually early 80, which is a terrifying thought. And began to study that system of pulse fairly intensely, working with physicians in Nepal and North India, working with Yeshe Dandan and Pema Dorje and other physicians. And then because of the overlap with the materia medica in Tibetan medicine and Ayurveda, I started to study Chinese herbal medicine in about 1982, and then encountered, of course, this system of pulse diagnosis, which we won't spend time talking about Tibetan medicine pulse diagnosis, but it's quite different in many important ways and has some similar ideas. So one of the things I think that's very interesting is you have to kind of encounter the fact that lots of traditions use pulse, and almost all traditions that use pulse favor the radial artery, but the way they approach pulse and the way they organize pulse information can be dramatically different. So I completed my Chinese medicine studies formally in 1989, and at that time I became very, very interested in the work that Leon Hammer had done via John Shen. Some of you, are you familiar with that at all? Or am I, yes, no? No. You've been on it, okay. So I did actually a fairly substantial number of courses with Leon. Worked closely with some of his senior teachers at the time, and and really got an enormous amount out of it. At the end, I concluded what some of his other teachers, who obviously aren't teaching for him anymore, concluded, and that was that there's an enormous amount of insight there, and there's a phenomenally, how shall we say, organized and engaged method of pulse assessment, but that from a Chinese medicine point of view, you can actually do and engage most of the sensation that's critical to Chinese medicine diagnosis without necessarily having to diverge as far from the standard terminology. And this aspect of terminology is very, very important. So I guess what I'm trying to say to you is I've been fussing with pulse for about 28 years or something, which is just a terrifying thought. And I'm still a student too, right? It's probably the best place to be in terms of thinking about pulse. Because if you think about pulse, the longing to be an absolute expert, how shall we say, drags you into a kind of artificiality and falsity that's a little dangerous. But an open mind around pulse, and you're always learning from every patient. And that's really our goal today, is to give you a skill set that you can take, as Angelika said, into your clinic and continue to build on with confidence and with the ability to build almost indefinitely from that point.